Push it. Do you guys want any hygiene buttons? Want some? Yeah. Hygiene buttons. Do you want to take those and hand them out? Yeah. This side? Do you want to take one and hand one this side? Yeah. All right, guys.
Right in front of me. Thank you.
All right, guys, we're going to start class. Guys, are you passing around your study guide? We need to start class. We've got a lot of stuff to cover. Everybody got a study guide?
That's pretty bad. Oh, thanks, Brian. Oh, yeah.
Brian, do you have one?
Yes.
Did you get one, Sabine? Okay.
I guess this is extra.
Extras. Everybody got their study guide?
You go? Oh, you go.
I don't have one. Oh, yes, I do.
You have one? Everybody has a study guide so we could start? We're moving around anywhere? Coming around? I have only one here. One more.
That's cute.
Coming around? Does anybody have study guides?
Oh, yeah.
The lady that
Yeah. Yeah. Oh, what did it say?
he had like one of those toothpicks that have like a floss. And it was paper. He said, use no else.
Oh, yeah, I saw that. Yeah. Oh, I didn't see the thing, but I saw it just do it.
Everybody has
That's
a study
like,
guide?
yeah.
Naveen, do you have a study guide? Everybody? Okay.
Oh,
We'll go ahead and get started. All right, are you guys doing okay on the quizzes? Talk to me.
couple tricky questions.
What's going on? Are the study guides helpful to you? That's the moving parts to this course. And if I could take a hand and remove them and put them somewhere else, honestly, I would, because I love having a full 2 hours with you so we can really talk over a lot of things and spend time. But unfortunately, I don't. And the way this quarter is scheduled, lunch and learns go with this class, and they like the flow to go into this class. The problem is sometimes we get the overflow, right? And it cuts down the time we can sit and cover material. And that's what I'm learning, and that's what I'm trying to give you guys these guides so that I know that I'm having to move quickly. But I would recommend, like I said earlier with this class, it's kind of a warm and fuzzy feel-good class. It's not as scary as oral pass. But if you don't study, it comes back to bite you. So go over this with some time. If there's anything I didn't cover that you want clarification on, email me. Talk to me. Let me know with some time. Yes?
Can we go over the codes?
Not right this moment, but we can when we finish what we need to cover. Okay, and that's the other issue I'm noticing with having the overflow from the lunch and learn, is it takes away from a lot of stuff that we need to cover and that we should cover. But what I would do is if you guys have questions right now on the first 2 quizzes, email me, okay? And I will answer your questions. AJ, if you have questions, Naveen, anybody with any questions on those, let me know. Okay? Yes?
Can we review our quizzes with you?
Absolutely. Absolutely. But I can't hand it back. I don't do that. All right. Okay. So let's get started. I'm going to assume everyone has their study guide. All right. So we're talking a little bit more about toothbrushes and toothbrushing. Today, the way Oral-B landed, it worked out perfectly. So I've been working with you guys on clinic, and I know you guys have been recommending toothbrushes and working with patients on their brushing. What we're going to cover is the difference in the design of toothbrushes. I want you guys to understand. We know they're effective. They're the #1 tool patients use. If anything, they're toothbrushing, right? So we're going to learn the different styles that toothbrushes come in, that they're a basic intro to prevention. And what is the purpose of brushing, really? It's to disrupt and control plaque and biofilm, okay? And overall, the reason when I hear you guys give OHI on clinic that we give OHI is because the importance of plaque removal. If they're thorough, they can reduce their risk of gum disease and dental caries and any kind of dental infection, okay? So what are our options when we're recommending toothbrushes? Okay, some practices, as you get out into private practice, there may be incentives to sell brushes or power brushes. What you want to keep in mind is whatever you recommend, and Bernadette touched on that, it's really what is evidence-based. So you want to have a good working knowledge of some of the different models that are out there so that you can make a good recommendation or give your patients some choices, okay? So let's get into toothbrushing. All right, so why do we use a toothbrush? Yeah, absolutely. We remove plaque. And we know that it's very effective on fronts of teeth, backs of teeth, biting surfaces, not so much between teeth, not so much under bridges. We recommend that they brush at least twice a day, follow it up with flossing. And toothbrushes come in different designs. We have the head, the shank, the handle, right? They can have large heads, they can have small heads, they can have handles that are narrow or wide. They come in different sizes, adult and children. We know that some of the bristles vary. What do we recommend on clinic for our patients as far as bristle? Soft. And what about if we had a patient that was extra sensitive? Extra soft. Okay, so we're going to focus a little bit on what makes up those bristles, what makes the bristles hard or soft, what makes them pliable and bendable and really stiff, and the types of bristles. And brush heads come in all different shapes. We have some that are all even. We have some that are kind of convex. We have some with a tuft at the end to help reach back teeth, right? We even have some bristles, if you wear them down, they start to change color and tell patients when it's time to throw them out and get a new one. We've had those for a while, those little indicator bristles. They start turning white. Okay. So, nylon versus natural bristles. Make a note of that under the first point in your study guide. Slide 13 and slide 14 we're going to go over. Why is this important? Why do you need to know this?
Are
Okay.
there extra study guides?
Did you already set up for anesthesia?
Yes.
Okay. I was going to give you guys a break in class for that. That's why we started. Did everybody that came in late, was it because, okay, is that everybody?
No.
Okay, because we started, because I am going to give you a 10-minute break later in class. Do you need one?
Although I think we only have 6 chairs assigned and like 6 of us clean.
Well,
So-
hang on, that's why I was going to tell you when I gave you the break, Ms. Lee told me to tell you. There's only 6 chairs, so you will have to find a partner and be 2 per chair.
So I think all 6 of them are clean now. So
They are clean,
Yeah,
so
so-
2 to a chair.
So
And
fitness
ask-
break.
So I'm
Jeanette,
saying we
huh?
don't have to have a
So
break to
Kevin's
go clean
finished.
them because they're already clean.
They're all clean, but are they set up?
Yeah.
So she wants you to be set up and cleaned. They're all there, so you guys don't need to set it up.
Like it has barriers already?
Very.
And that's all, is that all, you guys, Sarah? is that all that Miss Lee wanted you guys to set up before you meet with her at 3?
Do we have to take vitamins and stuff?
I don't think so. I think she just wanted you to get set up, have it cleaned, and everything infection control appropriate and ready to go over anesthesia. She's going over that with you guys?
When I write something.
No break.
Well, then Kevin might be on the Well, let's do this, guys. Let's finish what we need to.
Yeah.
And then those of you who haven't gone yet, just to be on the safe side and make sure you're ready for Miss Lee, well, I'll let you guys go and do that, okay? All right. Now, everybody has one? Okay, so we'll get back to bristles. We're at the first point of the study guide. So slide 13 and 14. We're going to talk about natural versus nylon bristles. Know that those are the two types of varieties that bristles come in. And also that the stiffness or firmness of a bristle is based on the width, the length, and the number of filaments, right? If there are fewer filaments, they're very short, or there's many filaments, it's very short, and they're all the same length. Is that going to be pretty firm?
Yeah.
Why is that? That won't bend, right? But if we have fewer and we have longer, and we're going to learn about a process you'll see in point 1 of your study guide known as end rounding. Be familiar with that. Grab a pencil. I'm going to tell you what end rounding is. It's a heat treatment in which each filament is sealed and rounded. And that makes that bristle less abrasive to the gum tissue. So do we recommend bristles that are end rounded?
Yes.
Absolutely. We recommend a good quality toothbrush where the bristles are soft, and if they're soft, they're usually end rounded. Yes? End rounding? End rounding is a heat treatment in which each filament end is sealed and rounded. Okay? There are no loose, rough edges. Like look here in the slide in these pictures. What if your bristles were really worn and looked like that? Could you see the other reason we recommend our patients replace bristles? What happens with wear? Look at that. It could actually now become more damaging because guess what? It's opening up, right? So they're not getting the plaque off. So what are they doing now? Harder, right? Because they feel stuff, so they want to really get it. What do all those edged, pointy, worn out bristles end up doing? Yes. It does two things. It abrades the gum tissue and the tooth. So that's the reason we recommend toothbrush bristles stay in good shape, that they get a new toothbrush frequently, and that we recommend bristles be end rounded. Do you guys understand that? End rounding? Okay. And again, when we look at these bristles, what type of bristle is recommended for someone with a sensitive teeth and gum recession? Soft, extra soft bristles. Extra soft if they're sensitive, okay? If there are regular adult prophy, there's no sensitivity or recession issues, we recommend a soft toothbrush. But if they have sensitivity problems, they have a history of already brushing away the gingiva and we see gum recession, we recommend extra soft. Remember that, you'll see it again. Got it? All right, take a look at all the different angles of handles that we have. All different ones to be familiar with. Different types of patients you can recommend that to depending on where their problem areas are or where when you give them OHI you see a pattern that they're missing. Okay? If they're missing, let's say, their back molars, their wisdom teeth, what kind of a brush head would you recommend? Angled? What size? A great big one? What size? Small. Why? What do you think is going on when they brush? They're opening wide because they want to get back there. And what is that wide opening doing? It makes it even harder. Then they stop. You'll see it. The They'll be really good till about the second molar, but from the distal of the second molar and the third molar will be totally covered with plaque because that's as far as they can go. So what do you have them do? You have them close a little bit, right? So that they can further back. And you have them use an angled brush and one with a small head. And if they're not sensitive, what type of bristle? Regular soft. And if they are?
Extra soft.
And what type of process do we want those bristles to go through?
Round.
End rounding, yes. All right. So, you guys have reviewed, I saw this, you guys have done all the different forms of brushing?
Yes.
There we go. Let me see. I found this chart, where was it? Nope, it's right here. You guys have done all of these, we know most of our patients are doing the horizontal scrub. Are you familiar with phones? Have you guys covered that at all? No. Some of the different techniques, phones for children? No. That's a popular one for kids, but it's where they close their mouth, keep teeth together, and we do circles, so we're doing upper and lower arch at the same time. Not ideal for your periodontal patients or most of your adult patients, but for teaching young children the basic skills, or those that have disabilities, the basic skills, phones can be very effective. What is the main one you guys teach in clinic?
Modified bass.
Modified bass. You need to be familiar with the angle and what you do because you'll see it on the test. So let's take a look at it. You have your modified bass. What's the degree you hold it on the gum line?
45.
45, and then what do you do?
Circular motion.
Circular motion, and what makes it modified?
Which was the focus?
The rolling, right? Right? It's the rolling. If it's just bass, do we do the rolling technique?
No, you just do this.
Right. It's the vibrating and staying right along the gum line at 45 degrees. But it's modified bass that you guys are doing. And with the modification, it includes rolling that brush. Okay? So be familiar. You'll see it again on a question. I'm pretty sure you've already gone through it, but it's still posted under this week in Canvas. All right, so we talked about that. Now, here's another question. Visualize this. You're giving your patient OHI. How would you evaluate a patient who's missing plaque on the right lingual surface of the right maxilla quad? Think about it. Right lingual surface of the right maxillary quad.
Right-handed.
Are they right-handed?
Right.
Yeah, they're right-handed.
Why did you answer that? Why would that be such an easy position to miss?
Because people.
Dexterity.
Right? Do we often think about turning it around? That takes more thought, right? To really make sure that we're not missing. It's easy to do this and clearly front, right? But turning it around. Now, what if you had a patient that was missing plaque? You're teaching them modified bass. Was missing plaque on the lingual of the left maxillary quad. Are they right-handed or left-handed?
Left-handed.
It's this, right? That's where they're missing. So visualize that. Know that that's a very, very common thing you're going to see from your regular adult profis to your RPs when you're evaluating their hygiene and doing their plaque scores many times. That's where you'll see a lot of plaque. And that's the most common spot to miss. Okay? And remember that because you'll see it on your quiz. All right? Okay, we talked about some of the different ones. Now, power toothbrushes. This is another slide you guys need to remember. ADA seal of acceptance. It was given to power toothbrushes for what? Because they're wonderful and they vibrate and rotate. Because they have large handles. Because they have an app. Because what do they do? What do they clean? What?
Plaque reduction.
Plaque removal. That's what they got the seal for. Did one get a seal over another? Is one better than the other? We've heard the reps. They would probably talk to you till they're blue in the face about one being better than the other, but there's no evidence that is truly independent that supports that. It's really up to the user. Some people do better with a sonic hair or more that vibration. Others do better with a rotational. When I'm in practice, when I educate my patients on toothbrushes, I have them go try it out. They're available. You see those handles. They're on display at different stores. They could turn it on. They could feel it. They could see if this is something I would use. It's really the user. Giving them the tool, a power tool we know will remove plaque head and shoulders better than just manual brushing. And that's really wonderful. You could share that with your patients, and I would encourage you to share that with most of your patients. But which type is really up to them, what their preferences are. And if you notice that they would do better, let's say there's certain areas they're missing, that a sonic hair would help them remove plaque easier, that's what you may recommend. I usually, though, have them try it out first before they make that investment. And they appreciate that. Same thing with Oral-B. If I feel that they would do well with a rotational brush, that's what I'm going to recommend. But they don't have to necessarily buy that. I send them to try them out, hold on to them, check them out. We carry them both in my office. We have them on display. We don't necessarily sell them, but it's wonderful for patients to turn on and look and see, wow, I could use that, or I would prefer that, okay? So what I need you guys to remember is that the ADA gave them the seal because of their ability to effectively remove plaque. Okay, so we'll go on to the next one. Let's see. Okay, so we covered this a little bit with Bernadette. How do powered brushes work? How do they remove plaque? Huh?
Vibration,
Vibration. What are some of the methods that they do?
rotary, oscillation, and ultrasound.
Oscillating, rotating,
Side to side.
side to side, all those methods. And how fast do they move? Are they pretty static, or do they vibrate, rotate pretty quickly? What's the range? From 38 to 7,600 per minute. So that's pretty powerful. And that's why they got that seal of acceptance, because they're a very effective tool in removing plaque. Did you need to ask a question? Are you good? Okay, they're set for Oskies? Okay. So, powered brushes. Who do we recommend them to? Who do you recommend powered brushes to? I do, but who would be particular groups?
People with less
Iris
dexterity.
Older.
High risk caries, right? Because if they can remove more plaque, does that risk go down? What about perio? If it's plaque induced, you know how we're learning to classify, is this gingivitis plaque induced, right? Is this perio plaque induced? That may be a patient that would benefit. What else? What other special groups now?
People with that dexterity.
Yeah, dexterity, the handle. Ortho, I love that. Ortho, absolutely. What else?
Elderly.
Elderly. Yeah, because dexterity. Anybody else? What about children? That may not be a bad starting brush for a child to learn to brush, to get used to brushing a long time.
People that can afford it.
People that can afford it. Yeah, and actually you can, you know,
15 bucks.
you can get a pretty decent Oral-B that you plug in and leave on a charger for under 37 bucks. So it's not tremendous. You don't have to tell patients, and that's another thing I tell them, you don't always have to drop 200 bucks on a toothbrush. It may not fit in everyone's budget. Okay, and that doesn't necessarily mean you have a better brushing. You have more bells and whistles, right? You get the app, you get the flashing lights, you get, all the bristle indicators. But you can buy a basic model that you plug in, and the charger is the holder. And most of those have a basic 2-minute timer for easily under 40 bucks. Okay, and you can get a really good brushing. That's a power brush. So be aware, not just some of these high-end models you guys get to have an experience, but also some of the basic models and some of the price ranges. And that would also be a good thing to include in your project at the end of this class where we talk about toothbrushes and power brushes, a price range, and some of the places patients can look and purchase those products at a reduced cost. Okay, so we have different groups that you need to be aware of. What types of patients are power brushes helpful for? So let's learn about some of the effects of toothbrushing. I need you to be familiar with this. What are the effects of toothbrushing on the gum? If somebody is inappropriately brushing, what are you going to see? Trauma. You could see chronic and sometimes acute trauma. There's a difference between the patient that slipped that morning when they were coming in to see you. What's that going to look like? Really raw. What about the chronic overbrusher?
White. White.
Yeah, white, rolled, bunched up sometimes, really tight, and abrasion on the tooth as well. They don't stop at the gum. Yeah, no stifling. They brushed it away. So be familiar with that. What about the hard tissues? We talked about abrasion. What are the which teeth do they usually brush away first? Front teeth, usually canines. Canines are affected usually the most. Why? I don't know, but that seems to be people's spot. They tend to bear down. You know, we can have a discussion. Most people don't sit and think about what they're doing with their toothbrush stroke when they're brushing their teeth. They're usually thinking about their day before bed, what they have to do, or if their day started, where they're going, what they plan on doing. No one's thinking about, am I pushing too hard on my front canine? We just have a pattern, right? Haven't you guys done it? You're not thinking about it, you just brush your teeth. Well, your patients do that. So that's something when you give OHI, you can call attention to. You know, these are areas, and when I correct that, I'll have them start with where they're doing the most damage first. So now they know, okay, I'm going to start here because this is where I really need to work at easing up. Otherwise, it's too easy to go back into old habits. So that's something you can do when you see areas of gum recession or abrasion on the tooth. They can even have sensitivity as a result of just brushing the enamel away as it gets into the dentin, even on the tooth itself, a little wedging caused from overbrushing. So some ideas could be just like what I told you, or lessen up on some of the toothpaste. Use a toothpaste that isn't abrasive. Did you guys get a chance to look at what I posted on the module for this week on toothbrush or toothpaste abrasiveness? Anybody? Mm-hmm. This is kind of interesting. If you guys get a chance, take a look at it. It's in this week's module, and it's a reference for you. It basically rates them in order of abrasion. Ah, I lost where was that? There we go. See, will it? Yeah, there we go. The least abrasive is number 4. The relative dentin abrasion value, that's what they give them. All the way down to the most abrasive. And then at the bottom, you'll see this. It's a key so that you can identify which ones are the least and most abrasives. This is their table. 0 to 70 is low abrasive. 70 to 100, medium. 100 to 150, highly. And then over 150, you may want to steer them out of those, especially if you see a problem where they're really brushing the tooth away. So you guys have this. It's all posted in Canvas under the module for this week. And it's a fun reference to use, to have, to refer to, find out what they're using, and you can make a recommendation based on what their need is. Yeah, it's kind of neat to have. You could even laminate it for clinic. It's kind of handy. And patients like that, that's kind of the stuff they want to know when they ask you, what toothpaste should I use, right? And we want to give them evidence-based recommendations and steer them, give them some choices, not just one or two, and let them try it out. Okay? Okay, so we know what the effects of toothbrushing with improper techniques are. So let's talk about tongue cleaners. Does anybody use, bless you, does anybody use tongue cleaners? Hillary, you do? Use a tongue cleaner? What do you like about your tongue cleaner? Is it different from your toothbrush?
Yeah. Also, toothbrush has it, like tongue cleaner, like on the back.
Uh-huh.
I like the regular tongue cleaner. I actually ordered it.
What is it? Is yours plastic or metal? Because they come in both.
Plastic and it has like kind of rubbery plastic on the other side. So
Uh-huh.
you can scrape it off too. I like it that one better than metal because metal.
That would skin your tongue. I don't think I could do metal.
I like it. I like the plastic or rubber one better.
Does it do better than just brushing?
Yeah.
Does it?
It feels better afterward, after I scrape my tongue.
Your mouth feels cleaner.
Yeah.
That's good to know. Anybody else does use a tongue cleaner at all? Yeah? Do you? What do you think? How do you think it's different from your toothbrush?
I think it gets the dirt.
The dirt? What have you been eating? The dirt out, right? Get the crud out of there.
Yeah, better than the toothbrush.
Do you?
Yeah, especially if you use one of the electronic toothbrushes. Like, what are you doing? You're massaging your tongue with that toothbrush. So you need something to get it out.
Just really scrape it, like rake it?
Yeah.
Okay.
I can say that.
Who do you think a tongue cleaner would be good for?
Someone with hairy tongue.
It's true. We laugh, but it's true. Hairy tongue. Why would a hairy tongue benefit?
Hair needs breath.
It's like a comb. It traps all sorts of stuff. We laugh, but it's true, right? We laugh and they'll come to you and say, you know, how my tongue or the color looks bad, or I have bad breath, or how do I get rid of plaque? Or they have, all the teeth are clean, but we're wondering why there may be increase in caries, or there may be still bleeding, because bacteria live in there. And if you have an area that would be a good nest for plaque and bacteria to go that you're not cleaning, of course it would live there and increase your risk for dental caries and periodontal disease. Have you guys tried the tongue cleaners on the backs of toothbrushes? The little plastic? What was your experience? They don't work that well, do they? They kind of slide off your tongue. You feel like you don't do that much. I brush my tongue. I don't have a hairy tongue, but I brush my tongue. How about you?
People with geographic tongue, what would you recommend for that?
Tongue
Just
cleaner.
their actual tongue, like their toothbrush?
That's what Hillary was talking about. And I'd probably lean toward a plastic one, especially if they're having an issue. Not everybody with geographic tongue has a problem with that. Many of them are pretty good about brushing. Anybody else? Okay. So we have tongue cleaners. Look at all the variety we've had. Some of them look kind of like instruments of torture a little bit, but there's a variety out there to scrape and brush and clean. And again, these are going to be your patients where they complain about bad breath. They complain about plaque building up. They see that they don't like the color of their tongue. So these are some things you can go over. First of all, clean your tongue. Recommend a tongue cleaner. Educate them, number one, on this. And this is what I need you to write, this slide, number 26, on why is it important to remove bacteria from the tongue. The main reason is it's associated with caries and periodontal disease. It's very important to clean, whether it's with a cleaner or a toothbrush, okay? And if they're not brushing their tongue, I would, before I recommended a tongue cleaner, I would probably start with showing them how to properly brush their tongue. Yes, Hillary.
How often do you have to change your tongue cleaner?
Your tongue cleaner? I don't think you have to. I mean, unless, it just depends, how hard are you brushing your tongue? If it's plastic and it's starting to not be as effective, sure. But they would last quite a while, okay? And with the toothbrush, well, we know that it'd be every couple months, or when those bristles start to open up. All right, but that's where I'd start. And the main reason and what I need you to hone in on is because it's associated, if they're not brushing their tongue, with an increased risk of gum disease and tooth decay. All right, and they could present with clean teeth, but if that tongue is not being brushed, their decay rate will go up. And so will their gum, the bleeding will be there. All right, what time is it? 2:18. Do you guys want to take a quick 10-minute? Sure. Or do you want to power through the brushing part?
I need a workout.
Yeah, Kevin.
What are you going to do?
What do you want to do, Kevin?
Do you guys, we can only do one thing if we do this 10-minute. Well, if it's a, you guys, first of all, with anesthesia, are you confident you're ready for Miss Lee?
No.
Let's go check.
No, you don't.
Not Kevin. Are everybody, those who didn't go, are you guys confident? Catalina, you're pretty sure you guys are all ready?
We just have to grab our syringes.
Is that it?
Yeah.
Okay. That's it? Do you want Kevin to lead a fit? Okay, then it'll be a 2-minute fitness break and then we'll keep powering through because we could use the time.
All right.
All right. Come on, Kevin.
Come on.
Kevin.
Hustle, hustle. No, I'm not on the list.
Are you on the list? I don't know if you are. I have to check every
You should be. Said your workout workstation.
I mean, with all the
Can I use the
Huh? Yeah. Absolutely. But you get back on. I don't want to get out. There we go. What do you need? Okay. Okay, so you're gonna do it.
Electric slide?
All right, so you guys ready?
Yeah.
So we're kind of we're gonna do something Dannon did, but a different song.
All right.
Oh, La Macarena.
Originality.
All right, guys.
Damn.
You don't want a little Despacito in there? You can drop it.
That's 4 minutes long.
All right, there we go. Not too loud. I can't be too loud.
Is it on?
Come on, God.
Is the volume on? Oh, yeah. You'd hear it by now.
I'll come up to the side for this.
Oh, it's on mute. Hang on. Mute. Unmute. There. No, it's on mute.
No, it's on. It's just really low.
Kevin, check the volume in the computer.
It's on. Okay.
On the other side. In the screen? Bottom right?
Sick.
Oh, no. Oh, that's the other one you can see it.
Okay, everybody. Kevin, start us off.
Why? It's because I need the music. I can't do it without the music.
I think she's just teaching them. I don't think it's
We can do it without the music?
All right, so I guess we're gonna do it without the music.
Wait,
It's
where's
not-
the song?
It's not working.
With the mouse, go to the
song. Music video.
Which break?
all the way
Oh, okay.
Oh, it's not.
What other way?
Yeah, she's just teaching them.
Oh, unless we have to switch. Oh, sorry. Like, is there
You want to come teach us, Catalina?
I only do Despacito, sorry.
Suavemente, bebida.
Oh, look at. Hey, Dannon, how did you get your volume to work?
I just turned it up on the music video and on the computer.
What did you do?
She used our laptop.
Oh, I used my own laptop too.
Oh, did you?
If you put the
Here.
volume up in the computer.
Oh yeah, the very bottom next to the time, right there. Like that. There you go.
Yeah.
Oh, there we go.
Palms facing down.
There we go, guys.
Right hand.
All right.
You have to, if you don't go like that, you have
The
to.
next move is simply to turn your palms.
Do the chicken dance. Come on. Yeah, chicken dance.
There you go, right there.
Hey, only for data you use and never for data you don't. Thought plan by
Google 5.
Hey, you did that, Kevin. You did that right there.
I'm not really good at this.
Kev, I can see you doing that.
Go, Brian, go.
I'm not the leader.
Let's do this. Come on.
All right.
Up. You guys want to finish?
We're not even.
We need someone to lead us.
All right, let's start again. Ready, set, go.
Oh.
I did it right?
Whoa. Are we supposed to be doing the Macarena or what?
You see, I don't think that's it.
You picked the wrong one, bro. That was it.
Just do the, okay.
All right.
We should do the instructional video.
We should do the instructional video next time. All right. Let me. We're good. Thank you. You guys give them a round of applause. All right, here we go. All right, guys, let's finish.
All right.
Back to it. Okay, we did our tongue cleaners. Okay, how about smokers? Those with not just hairy tongue, but those who smoke. Fissured tongue. That's another one. And again, if using a manual brush, don't scrub, be gentle. That way you're more in control. And if you have a power brush, you may want to switch it off, so again, you're in control. It's not bouncing around in there. Okay. All right, so last point, and we touched on it a little bit with Bernadette, was understanding, here we go, tongue cleaners. Understanding what are some of the active ingredients in dentifrices and mouth rinses. For the quiz, what I need you guys to understand are the preventive and therapeutic effects of chlorhexidine, stannous fluoride, sodium fluoride. You know the differences. One remineralizes, one kills bacteria. Triclosan, just basically how that works, and essential oils. And the slides are down here. Focus on. Okay, we know that they come in cosmetic and therapeutic, whether it's a toothpaste or a mouthwash. They either make things beautiful and smell better, or they treat disease, kill bacteria, okay? Or they can now do both. They can whiten teeth, kill bacteria, remineralize. Look at all the varieties of Listerine that we have now. I remember back when I was in school, we only had that yellowy one that was just gross. That was it. And then mint started to come out, and that was really exciting. And now we have, what is it, fluoride in Listerine too. It does all sorts of stuff. And what's really great now is they even have one that doesn't have alcohol in it. That's one of their newer ones. Thank goodness. That's a great thing, especially for patients who have dry mouth. And they want to kill bacteria, but they don't want to dry out even more. The alcohol makes a huge difference. And also those who are dependent on alcohol and want to quit, or alcoholics, we have now products that can be very effective when we recommend certain products to them to use certain rinses that don't have alcohol. I think now even chlorhexidine comes non-alcoholic. So those choices are out there. Okay, so for those that are therapeutic. Two big ones are chlorhexidine and triclosan. We talked about stannous. We know that it's very effective. All three of those are very effective in controlling what? What?
Bacteria.
Plaque, bacteria. They're effective in controlling bacteria. We also have under therapeutic, bless you, those products that remineralize. And therefore we have different types of fluorides, like sodium fluoride. We have products that include xylitol. We have things like MI paste, yes.
So, stannous fluoride kills bacteria. Sodium fluoride remineralizes. That's the difference between them. Okay.
Yep. Yep. And sodium fluoride is a lot easier to put into a toothpaste because early on, stannous is not new. It's an old product. It's an old fluoride that's been revived. Okay? For a while, I know, yeah, because of that. But what's neat is the newer formulations in reviving stannous and putting it into toothpaste. These chemists that work at these pharmaceutical companies have found a way to put that stannous fluoride ion in the paste where it does not cause staining, okay? And it's effective and available to the tooth surface for the patient, which was the biggest challenge before. We didn't have the technology to do that. So when we had a periodontal patient and they were given stannous fluoride, it was like giving them chlorhexidine. You keep that recall tight so you can polish off some of the brown stain, because that's how it would stain, like chlorhexidine. And they didn't really like that, but if it improved their gum health, and it did, they did that. Now, the newer generations, we have Crest, we have Colgate. They've made it so that staining is no longer the issue that it was. It's very minor to non-existent, which is tremendous. And that's why Bernadette was saying most people, most adults have gingivitis or some kind of a gum issue. It might not be generalized, but it could be in a localized area. Don't hesitate to recommend a stannous fluoride paste. Okay, sodium fluoride is not to take away from it. It's wonderful. It prevents decay, and it's easy to package and put into products and flavor and whatnot, and patients don't get staining from it. The bigger challenge was stannous. But the difference is that stannous binds to bacteria and destroys it. Sodium fluoride primarily remineralizes the tooth. Pretty clear? And we know that in toothpaste there are inactive ingredients. That's how we get it to be a certain flavor, thickness. It can have abrasive qualities or not. Many times whitening pastes are more abrasive. Yes.
Mention about chlorhexidine and then triclosan.
We're going to get to that. No worries. Okay, so we know it has a lot of other stuff. What I want you to hone in on are the stuff that's active, the things that make it work, the types of patients you would recommend that to. We see that a lot of them do some amazing things now. You can have tartar control, you have odor control, we have remineralization, anti-gingivitis. But this right here is the crux of it, whether it's a mouth rinse or a toothpaste. I want you guys to be familiar with slide 37 on fluoride and therapeutic agents of mouth rinses, 38 and 39. We're going to go back over that. Okay? So, on this slide, stannous interferes with cell metabolism and bacteria die. And that is the mechanism of action for stannous. Sodium fluoride enhances remineralization. I need you to understand that. Okay? both cases, whether they're in a mouth rinse, like in the case of the slide, or in a toothpaste, our patients aren't eating it. They're using it for its purpose, brushing or rinsing and spitting it out. Chlorhexidine. What you need to know on chlorhexidine. It binds to the oral tissues, okay? It's going to be, they make a chlorhexidine varnish, but you don't use that too frequently. Primarily, we're going to recommend it as what? What form does chlorhexidine usually come in that we recommend?
Rinse.
A rinse, right. But be aware that you can varnish with it too. There is a varnish, a chlorhexidine varnish. The way it works is it binds to bacteria and it destroys the cell membrane. And what you need to know about substantivity. Do you guys know what substantivity is? Did you guys learn that in micro? What does that mean? If a product has high substantivity,
That's how long it lasts.
yeah, it kills bacteria the longest. So triclosan, stannous fluoride, chlorhexidine, which has the highest substantivity? Chlorhexidine. It's the most powerful. That's why it's by prescription or available through the dental office, because it has the strongest ability to inhibit bacterial from coming back. And that's why it's also an antimicrobial and anti-gingivitis, and they're not the same thing, because when I talk about antimicrobial, we use that in Cambra. It's one of the uses is to kill strep mutans for what? Caries control. Did you guys go over that with the Cambra routine, how the first week of every month they're doing chlorhexidine, right? To do what? To kill strep mutans. So remember that it's antibacterial, not just gingivitis bacteria, but also decay. All right? And then triclosan, you know that it kills bacteria and it's primarily an anti-periodontal agent. Okay? It's not going to affect you too much now because we're phasing it out. But have a working knowledge of those products. Pretty clear? Okay. So what factors must we considered when we're selecting an interdental aid? Let's switch over to interdental aids. All right. Toothbrushes take care of what?
Facial.
Facial? What surfaces? Lingual? What else? Occlusal. So we have to teach our patients how to use products that can clean effectively between their teeth. Okay? So what is one of the most common additions that we teach in OHI? I've seen all of you do this, right? Floss. And we incorporate techniques that basically when they use floss or any other interdental aid does not cause damage. And we have a ton of different interdental aids, from floss to toothpicks to end tuft brushes. It could be even yarn. We even talked about a tongue cleaner. We have electric powered aids. Remember those power flossers? Waterpik showed us one, Sonicare did too. So, when choosing a tool that we will help our patients utilize, what I need you to make a question mark, make a note on, under what factors is the gum tissue inflamed? That makes a big difference. If your gum tissue is inflamed, are you going to have as much space between your teeth? Comfortable space?
No,
Are you going to want to, if you haven't been cleaning in between, want to start cleaning in between?
not really.
Probably not. Right? So that's an uphill battle with your patient. So that's a really important note to make, because we want to, number one, look at the consistency of the gums in between the teeth, the size of the embrasures. Let's say there's no inflammation. Are the contacts tight, so regular floss would do the job, or would an end tuft brush or a proxa brush? And what size proxa brush? What size of a Tepi brush? Have you guys used the Tepi products yet in clinic for your patients? The space between their teeth is a huge factor. Another big point to remember is implants. We're going to talk a little bit about that. All right, so slide 6, slide 9, the level of inflammation. Another point in there to know is the patient's dexterity. If we recommend a product, keep in mind how easy is it for that individual to use? How comfortable will it be? Is there inflammation in the area? What are tools that we could recommend that would gently clean around an infected tender gum in between? Because that's usually where they're going to be sensitive, is in between. And yet that's the most important area for them to clean, right? That's why it's infected. And here's some examples of interdental spaces. Could you safely say floss would be great for patient A? Absolutely. Would you need to introduce anything else?
No.
For now.
Absolutely not. Keep it simple. Don't add more aids if you don't need it. Keep it simple for your patient so that they will be compliant. B, look at that. There's a little more space there. Maybe some mild inflammation. Okay, there's a little redness. What are some things you could recommend? We're going to cover that further. But do you see how the space makes a difference? Now look at patient C. Tissue's totally gone. So we're not worried about a tender gum in the spot. We're worried about how do we keep that space between those teeth, those roots, really clean. So do you see for all three that it would depend on the interdental space and the topography of the gingiva? Is it tight? Is it inflamed? Is it non-existent? Okay, so dental floss. We have a ton of different types of floss. Slide 12, I want you to be really familiar with all the different types of floss on your study guide where it says be familiar with the different types of floss, advantages and disadvantages. Could be slide 12. Understand that we have tufted floss, colored floss, flavored floss, impregnated floss. Caries control, do you know what that is? They're fluoride coated. Fluoride in your floss, you'll see that. Sometimes we look past it. Sometimes the woven. Have you guys seen the little blue and white woven floss? Did you guys ever offer those in clinic? Some of those are impregnated with fluoride. They'll have the floss that's kind of all in one. We have fluoride in this, and some of them even like to say they whiten. They really don't, other than remove plaque that might stain. But that's an example of impregnated floss. Would be for patients with caries, extra fluoride, take it in between the teeth, easy to use if they have tight spots, and you can show them how to use it with their fingers or a floss holder. Waxed, unwaxed. Have you guys used the tufted floss?
Mm-hmm.
Have you guys used that on clinic? Super floss?
For bridges.
Implants, because it's nice and thick and easy to use, and it has those built-in firm ends, so they don't have to go get a threader, and do that too. They can just get in there and use it. Bridges, they're wonderful. Do you know why patients in particular with bridges like the tufted floss? Do patients with bridges often floss under them? Number one, it makes it easy. But if you haven't flossed, how does your tissue feel under the Pontic? How do you think it feels? You take floss under there with a threader, and they're like, ooh, easy, easy, right? It hurts. The tufted floss is like yarn. And you can even, if they haven't been a regular flosser, and let's say you don't have tufted floss, you can even recommend yarn and a floss threader, because the softness of yarn or the tufted floss is gentle as they start cleaning under that Pontic. Regular floss is usually you have two ends, right? And those ends, if they're not a regular flosser, remember inflammation, that can make it really uncomfortable. So not only are they going to stay non-compliant, they didn't really do it to begin with. They really don't want to do it because what? It hurts. And most people don't look forward to that. Okay? So that's where you have to be familiar with some of the different types of floss. How often do we recommend using an interproximal aid to remove plaque?
Once a day.
Once a day, exactly. Once a day. Once every 24 hours. Now, if they can do it twice a day, that's even better. But once a day, once every 24 hours, we want to make sure that they get in there and remove plaque. All right, so you guys are pretty good. I've been listening to all of you do OHI. You're pretty good about making a C around the tooth. How much floss should you be using? Yeah, a lot. Okay, so we're going to move on to some of the other ones. You guys are pretty effective at this. These are some other options you have. There's yarn, there's gauze, there's pipe cleaners. We don't see a lot of these anymore because we have a lot of products now for in between that take their place. Did you have a question?
Yeah, so did you say floss before brushing or brushing before flossing?
Floss before brushing.
That's what I always do.
Because I've heard other instructors say
Brush before flossing.
So I don't know which was like the correct way.
Floss before brushing. But what do most of us do, me included?
Brush.
Right. But yeah, ideally, technically, and do you guys understand the reason behind that?
Yeah, because those are
Yeah, because when you floss first, technically, you're removing debris from between, and then when you go back over with your toothbrush, you're removing it out of the sulcus easier, because stuff gets wedged. Okay? But most of us, and I do that too, I brush first. But when we educate, and you're going to see this, and that's a really good question, Kevin, because you're going to see it on national boards, and the answer really is floss first, then brush. Okay? Good question. Yep. All right, so let's see. Let's move on to floss threaders. We have floss holders. I've seen you guys demonstrate that on patients. Who do you recommend a floss holder for?
Someone who has bad dexterity.
Oh.
Dexterity.
Dexterity, excellent. Who else?
Other
Kids?
Gaggers, kids. What about patients that don't like to put their hands in their mouth?
Ah.
That's a good one.
like
And the
mechanics.
meaty hands.
Yeah, they don't like that. Yep. Okay. So let's move on to floss threaders. What type of patients
People with
benefit
braces.
from this?
ortho.
Slide 20 for the point on your study guide. When are floss threaders recommended? Be familiar. Under Pontics, around ortho, between splinted teeth. Teeth that are connected where there's no way to get floss the traditional way. Floss threaders help us navigate that. Okay? It can even be around implants if we put yarn or tufted floss to make sure we're not scratching an implant. All those areas that a patient couldn't traditionally go in between the contacts, a floss threader would be beneficial. So slide 20,
How do you even use that?
be familiar. Okay, what is the purpose of the end tuft? We see that in ortho. We see some of those power cleaners. Hummingbird. Those are older. Those have been around a long time. Have you guys seen those?
No.
That was an early combination of a floss holder and a power flosser. And it didn't squirt air or water. It just, you had a snap-on head that went on it, and you put it in like a floss holder, and it would vibrate up and down. That was the Hummingbird. They're kind of phasing out now, so you don't see them as often. Now you see the newer generation stuff where Waterpik and Sonicare are showing you the puff of air or the squirt of water that's pretty firm to clean in between. But that was one of our early models. Okay, interdental brushes. Proxabrushes. What can you do with Proxabrushes? Who can you recommend Proxabrushes for?
Big embrasures.
Diastemas.
Yes, diastemas, ortho,
Type 3.
type 3, perio, right? Spaces between their teeth, partials. The big ones for the clasps. Those are clasp brushes. I hope you wouldn't have a gap that big to have a Teppy brush in. Okay, single tuft. This is what I need you guys to know. Know the different names of an end tuft brush. They're called unitufts, single tufts, end tufts. 25 and 26, under what is the purpose of the end tuft brush? What areas does it help to remove plaque? Think about your end tuft like a back scratcher. It's going to be the brush you're going to recommend to help that patient reach areas they can't reach. If it's behind a wisdom tooth, an end tuft brush has a tiny little head.
So that's a single top?
Well, a few little tufts, but they look just like that. See that?
Okay.
It's going to be a brush that you can even clean. Let's say you are missing a tooth right there, and the gap is too small for a regular brush to get in. An end tuft could get around there. Okay, so your patients that have gaps, like they're missing a tooth. A patient that can't reach, let's say, the back of their second molar, or even they're having a time with a regular brush and closing, getting their wisdom teeth, that's the brush you recommend. It helps to give them access to areas that are difficult. So, under what is the purpose of the end tuft brush? It's to clean open intraproximal areas around dental appliances. It could be braces. It could be implants, difficult to reach, and especially helpful for back teeth and distal surfaces, like third molars, and even a type 3 embrasure where they have a large space. So think of large interproximal spaces where a standard toothbrush, it'll never make the corner to get around and clean, and it may be even too wide for a Teppy. An end tuft can help. Okay? So what types of interdental aids do we recommend for implants? We have a stimulator, pretty similar to a toothpick. What's nice about rubber tips, do you guys hand those out at clinic at all? Do you guys have them here? No? They tend to be nice for patients to carry if they have a problem with food trapping. I've made that recommendation to several patients. Carry it in your purse, cars, trucks, whatever. Poke food out. These will be your periodontal patients. Usually they'll say, what do I do after I eat? And I can't always brush. It drives me nuts. I feel it with my tongue. I have food stuck there. They would love rubber tips. These are your patients you recommend those to. Those are great. Patients love them. That tip stays good for a while. They can buy, after they get the handle, they can get even the replacement heads at most drugstores. And it just helps them reach and poke stuff out without having to stick their hands in their mouth. So it's practical to recommend. Okay? It helps them massage their gums. Your patients that want to ask, hey, how do I improve my gum health? I have a lot of mine. Keep it by their remote. When they're watching TV, they toothpick with it. I prefer a rubber tip because it doesn't splinter. It's easier for them to wipe down and keep clean and handy to use. We have a lot of stuff here that you're not going to really recommend that often. Toothpicks. Again, the gentle, the Stimudent. These are all a lot of your older stuff we used to use when I was in school to recommend for cleaning in between. We don't see them as often. And now that we have better products, we're not recommending toothpicks and Stimudents as much. We have products now like Waterpick. A lot easier, a lot more beneficial. We're not worrying about splintering and trauma to the papilla like we were with some of the wooden toothpicks. Patients may still like them. Some of our older patients may lean that way. I generally like to introduce them to some of the newer products. But if they do, with any of the wooden products, you just want to make sure that they're careful to only use it where they have a space. Don't make a space. because that's the problem with some of those toothpicks and stimulants. When they're improperly used, patients can really traumatize their tissue, and that gum doesn't grow back. All right, implant care. This you guys need to be really familiar with. Implant care. It's very important that we teach them to clean plaque off the implant. What is the main reason? Will the implant get cavities, decay?
Cause that to fail.
Yes, and how do they fail if they don't keep it clean? What can they get? Peri-implantitis, which is like periodontitis, okay? The other thing we need to really make sure that they know is that when they clean their implant, they don't scratch it. Get a note ready, because I'm going to tell you something you need to know, and you're going to hear more about it when the Tepi rep comes. We recommend Toothbrushes many times for around appliances. With an implant, you have to be careful. Do you guys know why? The wire, right. Tepi brushes, though, are safe because that wire is coated with plastic, and that protects it from scratching implants. So, can you recommend Tepi brushes to clean around implants?
Yes.
Yes. Any brush that you would recommend Toothbrush-wise to clean around an implant, make sure that that wire, and educate your implant patient, is coated, and it'll usually say coated. If they see a stainless steel wire, not a good idea. But Tepi is a safe brand, and when they came out, it was mainly to be used in that regard. And I mean, we've used them for just about everyone, but that's a safe option. Okay, so what are contraindications to caring for implants? What are contraindications on implant care?
No metal.
No metal. No metal. We don't want metal. We want them to be able to clean plaque thoroughly. We can use tufted floss. We can use end tufts, but we can't use anything that has metal that could scrape or irritate or damage the implant. And many times in implant patients, we also see that they have xerostomia. When we're soaping their meds, we see that some of those meds have that tendency, and we look in the mouth and the tongue gets really dry when you're probing. Those are your patients that you really want to make sure that you bring them in more frequently, that you're keeping an eye on how well they're removing plaque, because when you don't have saliva, what do you tend to accumulate easily? Plaque. Yeah, patients dry mouth, they tend to have that. So we want to really tighten them up and make sure that they know how to care for their implant, that they reduce their risk of peri-implantitis, and they don't get scratched. So plastic instruments only. Any questions for next week? How are you guys doing on your behavior modification project? Have you guys started? Your project for behavior modification? Start looking at it, guys, okay? We'll talk about it next class period a little more. I'm going to let you guys loose because you can go meet up with Miss Lee. All right, see ya. Good luck tomorrow.
Thank you.
Yes.
Do you have
Yes. Yes. Yes.
No, I said August. Right now? I have to go back.
Wait, but we just did anyone in class?
Let me wait.
Oh, wow.
Like I left to Panera,
Yeah?
and when I looked up, it was already there. I was like,
Oh, shit. No, just, yeah, just something. But I'm gonna, I have to go over there. Yeah, I have to do that, and I have to
But those are your patients that you
then I'll be completely good.
Okay.
Nah, bro. I need to study. I mean, I think we really have to study the mental.
Because you like how it
I mean, rest of it, I kind of have an idea. Yeah. I mean, class is only like 9. There's like, yeah, it's like that. She said in the recording, like, you should just know your common steps like linear algebra.
Yeah.
I wrote down a list.
Feel like it tastes better.
I'll show you the list.
Yeah. The things you have to really be careful of is
That's okay.
hard stuff because then you're using a rubber tip in the
Okay. Yeah.
soft yarn or soft
Banana today or? Oh, that's right.
Does that make sense? Yeah.
Okay.
I went to the one close to your house.
Oh, you did? Like, by Redlands Boulevard?
I said the office there.
Oh, she was there?
Yeah, we're in the same boat.
That's funny.
They were more empty.
They were more empty? Oh, okay.
But they also have less charges.
Oh, that's the thing. Yeah, there's like 2 spots pretty much I go to.
I don't want to go to Starbucks.
Yeah.
Sometimes Starbucks, they're pretty like uncomfortable. Because I don't care about the noise no more because I have the headphones.
Yeah. Okay. So, hey, what's up, bro? What's up?
Hey, kid.
Oh, good.
So, hey, do you guys know what this means? SA?
Hey, no.
Oh, okay.
Excuse me, bro?
Oh,
Let me
no,
go
bro.
see if I can.